So first presenter is Dr. Pratheeba Devi NIVEAN. Is she there?
Yes, sir.
Yeah. Meanwhile, can I have Dr. Chavi Gupta on the other podium? Audio visual, please make arrangements on the both podium. Yeah. Dr. Pratheeba, she is going to talk on, she is the winner of AIOS Sujatha Savitri Rao Award, joint winner, and she is going to talk on tier biomarkers in thyroid eye disease, first Indian study. Dr. Pratheeba.
Good morning. Thank you, sir. I thank the organizing committee for giving me a chance to present my project again in this podium. So, my study was on tier biomarkers in thyroid eye disease. It was a first Indian study. Sir, not move. So, thyroid eye disease, as we all know, is a complex autoimmune disorder. Understanding about the pathogenesis of thyroid eye disease is currently evolving a lot in terms of molecular aspects. The basic pathogenesis behind thyroid eye disease is autoimmunity. Due to inflammation, due to a trigger of inflammation which attacks the orbital tissues, there is antibody production against the self-antigens, which causes a lot of fat proliferation, which causes a type 1 disease, and or a fibrotic change which can cause a type 2 disease. Thyroid eye disease can vary from a simple presentation with an inactive disease as in first picture to a very dreadful scene as in the third picture with lot of exposure keratopathy and vision loss. So current scenario, what we do is we diagnose the disease, we do an activity scoring, we do a severity grading, and we treat the patient with steroids or immunosuppressants or radiotherapy or targeted therapies. But most of the people who treat thyroid eye disease will know that treatment of thyroid eye disease is not as simple as we explain in PPTs. It is very difficult because they keep recurring, so the management is very challenging. So what could be ideal is to identify the patients who will probably develop a very severe disease or an active disease before the onset of the disease. So we decided to look for any biomarkers that could tell us that this particular patient will have a severe or an active disease. So where all we can look for biomarkers, we can look in blood, fat, urine, and people have worked on even feces. But I chose tears as it is non-invasive, simple, and it is easy to procure. And I did some literature search and I found that there were a lot of interesting articles on tear biomarkers in thyroid eye disease as well. And this particular review was very interesting, and they had downlisted few cytokines, inflammatory markers, which were elevated in thyroid eye disease. So with this backup, I decided to go ahead with the study. We decided to look in for significant markers in tears causing thyroid eye disease. It was a pilot project done after ethics clearance. We diagnosed patients with Gorman and Broadley criteria. We did the activity scoring with Visa, and UGOGO was used for severity grading. Tear samples were taken from 2 centers, and the methodology was uniform in both the centers. The tears was procured using Schirmer strip, and it was transferred to another tertiary care center for analysis. And we collected samples of tears from healthy controls, patients with thyroid dysfunction but no eye disease, and patients with thyroid eye disease. We excluded patients who were not willing for the study. We basically did multiplex ELISA and looked for inflammatory markers, which was 14 inflammatory markers, cytokines, for this study. We had 19 patients with thyroid eye disease and 11 patients with thyroid disorder but no eye disease. We had 11 patients with inactive thyroid eye disease and 8 active patients. In our results showed that basically the inflammatory markers were elevated compared to the healthy controls in most of the among the cytokines, but we found that interleukin 6 and interleukin 10 were significantly elevated in patients with active thyroid eye disease. And we also noticed that the intraocular pressure was significantly elevated in patients with thyroid eye disease and dysthyroid optic neuropathy. On retrospective analysis, we also found that there were other interesting literature which have been reported that interleukin 6 antagonists have been used for the treatment of thyroid eye disease, like tocilizumab. And there are so many specific target antagonists for all these interleukins, which have been successfully being tried for thyroid eye disease. But they were all pilot projects, but many are under trial basis also. So the future could be a biomarker detection can give clue as in who could succumb to the disease, and it also can give clue about the potential markers, and we can treat them with the specific antagonist early so that they do not go in for a very severe active disease. So to conclude, your biomarkers can be promising clue to diagnose patients at risk of developing sight-threatening complications. I would like to thank the people who helped me throughout the study. Thank you.
Yeah, very nice study, Dr. Pratheeba. But how do you ensure that these biomarkers, like you said, interleukin 6, interleukin 10, they are not specific to thyroid eye disease? They may be increase in some other inflammatory eye diseases also. So how do you, is there any way to differentiate?
Yes, sir. You rightly said, sir. So any ocular inflammation, any ocular surface disorder will also have a raised interleukin. So how to be more specific? I'm continuing this study with orbital fat and comparing also. So that might give me an answer for that, if
Okay.
whether it is same or not.
Thank you.
Thank you.